Next, the rising toll of Lyme disease and the questions surrounding treatment.
We're back now with torrential flooding from a historic rainstorm slamming Phoenix, Arizona.
A health warning now out of Florida, where officials are sounding the alarm about a deadly bacteria that breeds in the water.
It's been another scorcher of a day in parts of the Southwest.
Arguably one of the most popular fast food restaurants linked to a salmonella outbreak here in Minnesota.
This could impact a lot of people. The health department investigating 17 Chipotle restaurants.
Climate change has been and will continue to lead to hotter days for places all over the world. As Arizonans, we understand heat. The most vulnerable populations to this are outside workers, city dwellers, northern areas, and low-income people. Heat-related injury and death will increase by thousands, including heat stroke, dehydration, and cardiovascular, respiratory, and cerebrovascular disease. According to the EPA, by the middle of this century, the coldest night of the year is projected to warm by 6 to 10 degrees over most of the country, and the warmest day of the year is projected to increase by 4 to 6 degrees in most areas. Climate change will lead to increased allergens, carbon dioxide levels, and wildfires, all of which will lead to more pollutants in our air. This will cause more asthma attacks and other respiratory and cardiovascular health effects. Air pollutants can damage respiratory tissue through inhalation, damage cells by oxidation, reduce lung function, and inflame airways. It can cause eye irritation, chest pain, coughing, nausea, headaches, chest congestion, and discomfort. Allergic illnesses, including hay fever, affect about 1/3 of the U.S. population, and more than 34 million Americans have been diagnosed with asthma. Climate change can lead to extreme weather events like increased precipitation, natural disasters, flooding, droughts, and storms. This will have a huge impact on human health by reducing the availability of food, damaging infrastructure that blocks access to hospitals, increased stomach and intestinal illness, and worsening mental health issues like PTSD. Disabled and older populations are most vulnerable, as they may struggle to articulate their needs, lack access to emergency exits, and are a struggle to evacuate and relocate. The potential for human casualties caused by extreme weather has increased in recent decades, as coastal population growth has increased at a greater rate than overall U.S. population growth. Vector-borne diseases are those transmitted by vectors such as mosquitoes, fleas, and ticks. Changes in temperature and weather can increase the geographic range of these vectors. Ticks that carry Lyme disease and mosquitoes that carry West Nile virus and malaria will expand more northward and have an active season earlier in the year. While the United States has the economic ability to prevent and treat these issues, poor countries are becoming infested with disease. Humans get sick when they drink contaminated water. And 8 pathogens, which are all affected to some degree by climate, account for approximately 97% of all suspected waterborne illnesses in the United States, which have severe health effects on humans.
The most common ones we see are gastrointestinal problems, ear, nose, and throat problems and infections, and skin rashes.
Waterborne pathogens are estimated to cause 8.5 to 12% of acute gastrointestinal illness cases in the United States, affecting between 12 million and 19 million people annually. Seafood such as shellfish can also be contaminated by this water and threaten human health when consumed. In the United States, the Centers for Disease Control and Prevention estimate that there are 48 million cases of foodborne illnesses per year, causing approximately 3,000 deaths, with this number expected to rise. Nutritious food is necessary for survival, and climate change has been found to impact food supply and nutrition in multiple ways. Rising temperatures can increase the risk of salmonella and other foodborne illnesses, as bacteria grow more rapidly in warm environments. Salmonella can cause gastrointestinal distress and even death, and carbon dioxide levels in the air can act as a fertilizer that makes food less nutritious. Additionally, extreme weather that injures infrastructure will impact food distribution and access. Climate change is often referred to in terms of the future. These things may happen. These things will lead to something else. But climate change is happening now. Early warning signs, adaptive infrastructure, and raising awareness are the most important things we can do in the United States to improve human health in the future. But in order to do this, we need to hold our government officials accountable and make them take these issues seriously. We can't have people like this guy running the EPA.
Do you believe that it's been proven that CO2 is the primary control knob for climate?
So no, I would not agree that it's a primary contributor to the global warming that we see.
Okay.